Hello, my name is Lizzie Ette and I am one of the lecturers in nursing at the University of Hull. So the adult nursing programme is structured over 3 years, very similar to the other fields of nursing. In your first year of study, you are welcomed in at what's called level 4, so you're very supported with the academic side of your studies. You would be assigned a personal supervisor so that you have one of the lecturers or one of the staff members assigned to you that kind of stays with you for your 3 years of your studies actually, to give you all a kind of what we call pastoral support and that kind of friendly access to a lot of our systems, because sometimes as a student it's hard to know who to go to with what kind of questions. So quite quickly in your first year you would be going out into a clinical environment and kind of having an opportunity to experience what it is to be a nurse. And you again very, very well supported by our practice colleagues. So we work very closely with our local providers, services, and you have the opportunity to go out into a clinical environment which might range from a surgical setting to a medical environment. It could be out in the community. As I say, it could be in a social care setting. But what's great about adult nursing is that you will quickly realise that you'll be working with patients or clients or service users of the entire lifespan. And the nursing programme is renowned for being quite challenging academically and in clinical practice, but the support that you get from the teaching team and from the university as a whole is phenomenal. In year 2, we go to level 5 academic work, which is a little bit more around critical thinking. So that's where we signpost you quite commonly to the library study skills support that's available to you to help you with your writing and your thinking around developing your critical thinking really. And then in your 3rd year, we really start to push you towards that qualification of becoming a registered adult nurse and becoming a registrant basically on the Nursing and Midwifery Council register. So we teach our students at level 6, which is more demanding, and again we give you a lot of support around that. The fantastic thing about becoming an adult nurse is the career potential that lies at the end of it. Again, there's a bit of a misconception that you might only ever be working with adults in your future career, but that's not true. As a health visitor, I worked with newborn babies right through to working with people at end of life. And some of our students come onto the nursing programme very clear about what it is they want to do when they qualify as a nurse, and others don't really have much idea, but those ideas are formed as they progress through their nurse education. So really, really exciting times ahead, and I would really love to welcome you into our nursing programme and hope to see you at some point in your future.